There is a call to bring peanuts and other allergens back to school lunch boxes, with some experts saying that banning allergens like nuts and peanuts at school providing a false sense of security. Allergies Quebec saying that this type of ban no longer has its place in 2024. Let's go to Dominique, Seigneur, Director of Communications for Allergies Quebec. Dominique, welcome to the program.
Good morning.
So why now? Why are you making this important call?
Well, it's been a few years, I have to say, that Allergies Quebec tries to reach different ministers, let's say health minister and education minister, the two main ministers involved in school management, to have their attention on this important problem we have in Quebec. We're the only province where we don't have any legislation or regulation to provide a standard framework for dealing with allergic students in schools. There are 75,000 kids living with food allergies in schools. That means about 2 students with allergies per class. And we're still the only province where the government does not know whether the school staff is able to react efficiently or not in case of an anaphylactic reaction. So what we're trying to say today is by banning, like we used to do in the 90s, it doesn't work anymore because it was easy then, because most of the allergies were related to peanuts and nuts. Today, in 2024, Health Canada reached a list, is providing a list of 10 foods that are causing most of the reactions. So it has this, we're saying it's not relevant today to just ban a couple items on the menu and then let the others have whatever they want, because there's more and more kids growing with eggs allergies, milk allergy, and it can be as fatal as nuts and peanuts. So I think it's time to revise the way the school staff is managing food allergies. This is our main message today.
Dominique, what do you say? Because we talked about this yesterday on the program, and I heard from parents like, my child could die if we change this policy, right? What do you say to someone whose counter argument is that if we change this, it could lead to a child dying?
Well, I think if we don't change it, it can lead to a child die, because honestly, asking people not to bring nuts and peanuts, there's no police checking their meals. What we have to do is make sure the people on site at school, they receive a training, which is not the case right now. Do they know how to use the epinephrine, EpiPen, or allergens? Most of them, they don't even know how to recognize the symptoms. They don't know how to act. They don't even know if they're allowed to inject the children if the child needs it. So it's really a matter of general training and having something like a legislation or a regulation that's surrounding the schools. Because right now some schools do it very well, some others they don't know where to start. So it's just having the government implicated in terms of regulation and standard procedures, because it's not by banning a food or two that we're going to make a good management of food allergies today. This is just not the way.
Can you, to wrap up here, can we just talk a little bit about best practices today? Because I know that and I'm a part of this group. I've got a young child. I have a 5-month-old now at home, right? And we're already talking. Okay, how do we introduce food and allergies and that kind of thing? What's the latest medical research like on how we should treat allergies with children?
Well, it's a very good question, because actually it really changed. The frame really changed in the last couple of years. So now the Canadian Pediatric Association recommends you introduce allergen foods between 4 and 6 months. As soon as your kid is ready. Let's say your kid is 5 months. He is starting with the cereals, with the fruits, the veggies, the meat. It should be a good timing to use some, let's say, peanut powder or a nut powder. Include them in a day-to-day feeding methods. So you can try eggs, you can try, the milk is sometimes already there, but you don't have to wait. The more you wait, the latest studies show that the least your kid is going to be exposed and the worse his immune system can act. So it's better to start early. But that's like 180-degree difference compared to what we were saying in the past years. I have a 15-year-old daughter who's anaphylactic to many foods. And when she was born, they were asking us to wait until they were around 10 months or 1-year-old for the allergens to make sure they didn't develop any reaction. In our case, it didn't change anything. But I hope for the future, if the parents follow the new guidelines, I hope it's going to bring the allergies down, because right now it's a medical condition that's increasing, unfortunately.
Dominique, we're going to have to leave it there. Really great having you touch base with us this morning. Hopefully we can talk again in the future.
Thank you so much. Have a good day.
You too. That's Dominique Seigneur, Director of Communications for Allergies, Quebec.